Assalamu alaikum wa rahmatullahi wa barakatuh. In this lecture, I will talk about an introduction into the blood supply to the abdominal viscera. Let's start with the divisions of the gastrointestinal tract. The primitive gut tube can be divided into foregut, midgut, and hindgut regions. The foregut start from the abdominal esophagus to the region just inferior to the major duodenal papilla. The midgut start from the region just inferior to the major duodenal papilla to the junction between the proximal 2/3 and distal third of the transverse colon. From this point starts the hindgut till the point midway in the anal canal between the upper and lower halves. Thus, the foregut include the abdominal esophagus, stomach, duodenum superior to the major duodenal papilla. The liver, pancreas, gallbladder, and spleen also develops in relation to the foregut region. The midgut includes the duodenum inferior to the major duodenal papilla, jejunum, ileum, cecum and appendix, ascending colon, right or proximal 2/3 of the transverse colon. The hindgut include the left 1/3 of the transverse colon, descending colon, sigmoid colon, rectum, and upper half of the anal canal. The three regions, foregut, midgut, and hindgut, are directly related to the areas of the distribution of the three anterior branches of the abdominal aorta. Thus, the foregut is supplied by the celiac trunk. The midgut is supplied by the superior mesenteric artery. The hindgut is supplied by the inferior mesenteric artery. This figure on the right side shows the distribution of the branches of the abdominal aorta. Abdominal aorta is the largest artery present in the abdominal cavity. It begins at the the aortic hiatus of the diaphragm, then descend along the posterior abdominal wall, as we see, till the level of the fourth lumbar vertebra, where it divides into two common iliac arteries. Along its course, it gives off the three anterior branches that supply the fore, mid, and hind guts. We can see here the origin of the celiac trunk and superior mesenteric artery from the front of the abdominal aorta. The celiac trunk arises at the level of the upper border of the first lumbar vertebra and gives off three main branches: left gastric, splenic, and common hepatic artery. The superior mesenteric arises just below it at the level of the lower border of the first lumbar vertebra and gives off branches to the midgut region. Here the three branches of the celiac trunk. The left gastric artery passes along the lesser curvature of the stomach. The splenic artery passes to the left side, gives off many pancreatic branches, splenic branches to the hilum of the spleen, short gastric arteries, and left gastroepiploic artery along the greater curvature of the stomach. The common hepatic artery passes to the right side and divides into proper hepatic and gastroduodenal arteries. The proper hepatic artery gives off the right and left hepatic artery. Also, the right hepatic artery gives the cystic artery. The gastroduodenal artery gives the superior pancreatico-duodenal and the right gastroepiploic artery that passes along the greater curvature of the stomach. The branches of the superior mesenteric artery are the inferior pancreatico-duodenal artery, this artery that supply pancreas and the inferior part of the duodenum. Also, the middle colic artery that divides to supply the right 2/3 of the transverse colon. The right colic artery that supply the upper part of the ascending colon. The ileocolic artery that gives many branches to the lower part of the ascending colon, cecum, terminal part of the ileum and appendix. Also multiple jejunal and ileal branches that distributed inside the mesentery to the jejunum and ileum. Now, what are the branches of the inferior mesenteric artery? As we see, the inferior mesenteric artery gives off the left colic artery that divides to supply the distal third of the transverse colon and the descending colon. Also gives off many sigmoid arteries to the sigmoid colon, and lastly the superior rectal artery. This figure shows the marginal artery of the colon, that is known as the marginal artery of Drummond. It runs inside the border of the colon. In many cases, it gives off the middle colic artery. It connects the branches of the superior and inferior mesenteric arteries. Thank you.